Local healthcare workers are on the front lines of this fight against COVID-19, but some of them tell us they're facing severe supply shortages. I spoke with an ER doctor today. We are joined by Dr. Jose Terradas from St. Mary's Medical Center in Langhorne. Doctor, thank you so much for your time. I know you are so busy. What's the biggest critical pressing need right now in your department?
What we're seeing, and thank you for having me, what we're seeing right now on the front lines is that we are quickly running out of personal protective equipment, otherwise known as PPE. And I think right now at the provider level, both EMS and doctors and nurses, is that we need to not leave our providers short.
How are you getting by in the meantime?
We're having to devise ways to reuse masks that were once deemed one-time use. We're putting them in paper bags, letting them air out. I'll be honest, a number of my colleagues have even looked into YouTube videos about how to clean or reuse our equipment.
From what you know, from your field, your experience, is that how it should be happening?
I think that if you asked anybody in a situation of calm and with plenty of resources and time, that anybody would tell you that that is not what would be expected to keep our community safe. We are a hospital. Every hospital deals with the entire community, and so if we don't have enough providers to be able to take care of those sick patients, we're in trouble.
Doctor, you have the platform here. What's your message to the governor, U.S. senators, Congress?
We need to think ahead, and we need to think boldly. It's a combination of having more ventilators. It's a combination of having beds, having enough contingency staffing models if a lot of providers go sick, because it's not just about flattening the curve, but also bringing that flat line up on the curve. And if we don't have enough doctors and nurses and respiratory therapists to take care of people, that's one problem. And the other problem is if we don't have enough ventilators or enough beds for the sickest patients, your doctors are going to be in a difficult position of having to choose what patients get the ventilator, which is shown to increase survival odds. So we're going to be put in very difficult situations if we do not act quickly.
You are an emergency room physician, correct?
Yes, sir.
What's the mood like in the ER?
Right now, it's a little bit of a calm before the storm. I think a lot of people have heeded the advice to stay home. I appreciate that significantly, that the community is listening. I think the government has done a good job in terms of at least recently getting the message out that we need to social distance. But I think even more importantly than any of this is that we need to save lives, and we need to think about our providers. And we're nervous and we're scared because we don't have enough equipment, and this is not any one hospital. This is the country-wide.
Dr. Jose Terradas, emergency room physician at St. Mary's Medical Center in Langhorne, Bucks County. Doctor, thank you so much for your time, and please stay safe. And as we were saying goodbye to the doctor, words from him that really hit home.
Honestly, please, like we are advocating, and you guys are an amplifier for us. And this is something that will keep. There's people listening right now in your newsroom. People will know people who will die if we do not act quickly and bravely, and that's the situation we're facing right now.
That was a shocking moment. Well, I was able to virtually ask Governor Tom Wolf what Pennsylvania is doing about personal protection equipment. He says conversations continue with the federal government.
We're also looking, and I've had conversations with manufacturers who are hoping that they can repurpose their manufacturing lines to produce these masks. If we don't find those, then the questioner is absolutely right. The healthcare workers are going to be put in harm's way, and we cannot afford that.
And as you just heard, that is already happening.